Okay. Here's my audience. Interpersonal speech. Imagine having to watch a family member as their health slowly or quickly, in some cases, declines, where they rely on others to take care of them because they're no longer able to. This can be the case for many who suffer from Huntington's disease, and Family Caregiver Alliance 2013 states that Huntington's disease, also known as Huntington's chorea, is a genetic brain disorder in which the person loses physical control and mental capacity. Huntington's disease is a known genetic disease that is becoming much more popular and known throughout the nation, and it can be very terrifying and horrific to the families when they find out that a family member suffers from this disease. And the Family Caregiver Alliance states that approximately 30,000 are diagnosed nationwide. I want to be able to teach and inform you a little bit more about what Huntington's disease is and the possible cause, how to test for the disease, some signs and symptoms, and lastly a little bit about some treatment options and if there is a cure. So first, let's talk about what Huntington's disease is. Huntington's disease history goes back quite a few years, and the Alzheimer's Association 2013 states that it wasn't until the 1800s that the physician George Huntington first described it, and it was believed that a genetic protein in the brain breaks down that affects the brain's mental capacity, which causes mental changes, mood disorders, depression, irritability, and uncontrollable movements. And the Medline Plus 2013 states that men and women of all ethnicities are actually affected equally, and the average age of onset, according to the Alzheimer's Association 2013, is between the ages of 30 and 50. However, some may be diagnosed younger or older, and some may actually carry the disease and never show signs and symptoms. And there's a good chance that if your parents carry the disease, it can be passed on to the offspring. And Medline Plus states that there's a 50% chance that it can be passed down to the offspring. And from personal experience, my mother has 3 siblings, 2 of which are diagnosed, and she actually does carry a lower number of the mutated gene. So since I told you a little bit about what Huntington's disease is, you may be asking, well, how do you test for it? According to Medline Plus 2013, to test for the disease, a genetic blood test can be done to tell if you will have the disease or carry the gene. However, genetic counseling is highly recommended before testing to make sure the benefits outweigh the risk of knowing about the disease. So I've talked a little bit about what Huntington's is and how to test for it. Now I'm going to explain a few of the signs and symptoms. I already discussed earlier that signs and symptoms typically develop in the middle age, and it is believed the hallmark symptom, according to the Alzheimer's Association 2013, is said to be the uncontrollable movement of the arms, legs, head, face, and upper body. Early symptoms of Huntington's disease typically don't take as big of a toll on the person's life as the later symptoms do, and Medline Plus 2013 states that the earlier symptoms of Huntington's is the uncontrollable movements, the difficulty walking, and balance problems. However, the later symptoms of Huntington's can take a bigger toll on the person's life, affecting the way that they perform their normal activities, and they may seek help from providers and other team members of the healthcare profession because they are no longer able to take care of themselves. And later symptoms, according to Medline Plus 2013, are the increasing difficulties of uncontrollable movements, the inability to possibly be able to walk, talk, swallow, and even speak. Some may no longer recognize family members, where others may somewhat be aware of their environment and surroundings. And another prime example of someone who was diagnosed with later symptoms of Huntington's was one of my mother's siblings, who did have to be put in a nursing facility to receive care because they were no longer able to perform all of their own care for themselves anymore. And the disease course with symptoms, according to Christy Taylor 2013, can last anywhere from 10 to 30 years after onset to death. So someone diagnosed middle age with Huntington's can really live quite a few years with this disease. So I've talked a little bit about what Huntington is and how to test for it and some signs and symptoms. So lastly, I'm going to tell you if there is a cure for this disease and some treatment options for the disease. Unfortunately, no cure yet exists for Huntington's. but according to helpguide.org 2013, the research being done is very promising in showing slowing of the progression of the disease. And once the disease is confirmed, patients are encouraged to continue a healthy lifestyle approach, adding other health support therapies as they become needed, such as physical, speech, and occupational therapy. And according to the Alzheimer's Association 2013, by adding a healthy diet, vitamins, exercise, and possible spiritual support to your daily life can actually help in slowing the progression of the disease. So since I've talked a little bit about what Huntington's is and how to test for it, some signs and symptoms, and lastly that there's unfortunately no cure but promising hope that there are treatments to slow the progression of the disease, I hope you have a better understanding about this devastating disease and never have to watch a loved one go through it. But for those of you who do suffer from Huntington's or have to watch a loved one go through it, I hope you've learned a little bit more about the disease and can better understand some possible treatments to help slow the progression. I'll show my crowd one more time.
Wave.
You can wave if you want. You got the bone. Then I just send